Hello, today I will introduce on the topic of education to teach new staff members at the hospital about the importance of hand hygiene. So first of all, I will introduce what is hand hygiene and the purpose of hand wash and the identification of the risks associated with the poor hand hygiene and the artificial fingernails. Next one, I will talk about when hand hygiene should be performed and a description of the cleaning product to be used and the important 5 moments of hand washing. Last one is a conclusion. What is hand hygiene? Effective hand hygiene is the single most effective action to reduce healthcare associated infections. Hand hygiene is a general term referring to any action of hand cleaning. Everyone, including the care workers, have a responsibility for workplace health and safety. One of the major control is infection control. For instance, hand hygiene, routine environment cleaning, and the cough etiquette, these are all things that need to be taken seriously. In the healthcare setting, the purpose of routine hand washing is to remove any bacterial contamination which can be occurred from another person's skin or from objects in the environment. That can refer to microbial reduction in an effort to reduce the risk of a nosocomial infection. According to Australian Commission on Safety and Equality in Healthcare, shows that the highest compliance rate and the largest number of hospitals submitting data was Victoria. They have a 70.5% from 86 hospitals. This demonstrates the benefit of using the program over several years, as Victoria began the process well before the start of the nation program. Moreover, contaminated hand or material can lead to natural dissemination disease. The most significant hygiene measure in preventing the diffuse of infection is hand washing. Infection can caused by transmit enough germ in the body from placing a finger in the mouth, rubbing the nose or eyes. The predominantly spread bacteria, fungi, and viruses, which is a person-to-person contact through the unclean hand. It also can addition to handling contaminated medical instrument and other hospital equipment. So, artificial fingernails. Healthcare workers who wear artificial nails are more likely to harbor gram-negative pathogens on their fingertips than are those who have natural nails, both before and after hand washing. Therefore, artificial nails should not be worn when having direct contact with high-risk patients. So hospital staff should pay attention to hand hygiene procedures. The first one is remove jewelry and apply enough pump liquid soap. Meanwhile, take care of what touching sink. Then, wet the hand thoroughly with warm water. Furthermore, lay the hands with soap and vigorously rub together to ensure all surfaces of the hand are covered. It takes approximately 20 seconds. Lastly, rinsing thoroughly under a moderate temperature of water. Then use a single towel wipe hands. Basics, turn off the tap with a dry towel. Clean hand protect against infection. It also protects oneself. In addition, everyone needs to clean hands regularly. Now I will talk about a description of a cleaning product to be used. The professional hospital use the method and the frequency correctly cleaning environmental garments and equipment that can provide the patient placed in contact are subject to rigid cleaning producers and sanitation for purpose of reduce or cancel the chance of infection. The most common measure of the infection involved is use of disinfectant solutions. Healthcare workers claim a high level of commitment with the recommended hand hygiene policies. Patients' health require a safe environment of care and adequate cleaning, sterilization of medical equipment, and environment service. They have 5 different moments. Hand hygiene moments divided by 5 different parts. A moment, which means when people skin outside to another through a person's hand, can be a rated or actual risk of pathogen transmission from. There are 5 moments which must be observed. The first is before touching a patient, need to washing hand. It also need before and after postures. Added workers should follow and hand hygiene after body fluid exposure risk and touching a patient, even after touching a patient's surroundings. In conclusion, one of the easiest way to facilitate keep patients as much as possible safe and healthy is all hospital staff treat hand hygiene seriously in hospital. Thank you for listening.